I'm Liz Nafziger, and I'm a neurologist at the Neurocare Center, as well as a palliative care specialist at the Goshen Center for Cancer Care. Most of my time is spent as a neurologist, and I have outpatient and inpatient practice. So in the hospital, I see people in consultation for stroke and seizures and altered mental status. In the outpatient setting, I think the scope is much more broad in terms of various neurologic diseases, multiple sclerosis, epilepsy, dementia. I see a wide array of things, in particular headaches that are refractory to first-line treatments, refractory migraine, refractory tension headaches, atypical forms of headaches. I think those are probably the most common thing that I see. The next kind of group of people would be movement disorders, so people who have tremor, people who may have Parkinson's disease, people who have restless legs. Seizures would be the other really big category of people. And then beyond that, multiple sclerosis. So people who have episodes or paroxysms of neurologic symptoms that aren't well explained. I help guide workup in terms of trying to get to a diagnosis, if that's a neuroimmunology disease or not. And then stroke, especially in follow-up after hospitalization for stroke, making sure that secondary prevention measures are in place. I chose neurology a lot because I liked the variety of diseases, and I thought it was kind of a unique intersection in between being a specialist and a general practitioner. So neurology kind of being more narrow compared to the broad scope of internal medicine, but with a wide array of things that I could still see. And specifically for palliative medicine, I thought that was the place I really got to know the patients. In medical school, that was the first rotation I felt like my job was to sit down and to listen to them. And I thought that's what I want to do. Like, I want to meet the patient where they're at. I want to try to tailor a plan to what's important to them, just like we can give reassurance to a patient about whether they have a serious or non-serious neurologic illness. We can do the same for a provider. So I think it depends on the disease when to refer to a neurologist. For headaches especially, there are many common treatments that the primary care provider can initiate first, and if headaches fail to respond to those things, then it would be appropriate to refer to me for ongoing management. So I really think some of it comes down to what's comfortable to the primary provider or not, and when in doubt, to reach out to the specialist. And we don't always have the answers, so even if it feels like, man, this patient is just a mystery, let's send him to a neurologist, we might not know either, but we're here to try to figure that out with you.